Okay, so we're talking about the hip today, folks. The hip. I put my hand up on your hip. When I dip, you dip, we dip. You put your hand up on my hip. When I dip, you dip, we dip. A little bit of the song, I think it was circa 1990, maybe a little bit later than that, late 90s. Put my hand up on your hip. When I dip, you dip, we dip. You put your hand up on my hip. When I dip, you dip, we dip. So what we're looking at here is my right hand, right here, is holding the femur. Okay, the femur is the longest, strongest bone in the body, arguably. Okay, the femur comes up to it joins the knee down below, and up top it's going to join together with what's called the femoroacetabular joint. It's going to function as part of that. It is the ball. The femur makes up the ball. All right, so here's the femoral head, and it pops out, and you see the ball right here. And if you look a little bit closer inside there, you can see the socket that it sits in. You'll see a tan sort of ring. Okay, all this material that is brownish tan there, that is called a labrum. A labrum is like a little bit of stitching that helps to harness this ball inside the socket. Okay, so we're talking about the femoroacetabular joint, the femoral head, and the labrum is that brownish tan structure in there, and then it sits in the socket, forms a part of the socket. I'll put that back in and turn this baby around. All right, it's kind of hard to imagine exactly what we're talking about here. This is what's called a hemipelvis. The rest of this stuff, this blade up here, it's called the hemipelvis. This is actually, this bone right here is termed the ilium. Okay, and the ischium is a bone back here, which we sit on. All right, and then the pubic bone is right up here. All right, so got the ilium, got the ischium, or the ischium, depending on who you talk to, and then you've got the pubis. So hemipelvis denotes that there is another side that is right up over here that joins together with the tailbone, a triangular structure in the middle. The low back's up top here. Here is a little bit of an illustration of that. What we've got is a little keychain device here, and try to hold it still for you. Again, down in the front we've got those two pubic bones that come together, and on the left hand side you've got that ilium, and the right hand side you got the other ilium, the pelvic bone, or not the pelvic bone, the stinking, you see that triangular looking sacrum, or the tailbone in the center of that. Okay, so 1, 2 makes a full pelvic girdle. All right. Well, we've talked about a lot already. We've got some ligaments that are lashing this pelvis together. Pelvis is known as the keystone of the spine, specifically the sacrum, or that tailbone, which sits right in the center between the two hemipelvi. That is the keystone of the spine. It's shaped accordingly, and it kind of wedges between these two hemipelvises, and hence it's a very stable, very important area when you're doing PT, when you're doing anything. You understand what I'm saying? You had better, damn it. Okay, talk about this pubic bone for a little bit. The pubic symphysis has a little bit of a fibrocartilaginous disc in here, a piece of cartilage, which is a little bit of a springy action to it, because it's not a true joint between these two pelvic bones. All right, what we've got instead is that piece of like an untrue joint. We've got that piece of cartilage joining in these two, so hence there's a little bit of motion in and out, side to side at this pelvic bone, which hence makes it very possible for a woman to open up the pelvic girdle and deliver an infant, child. Cool? So that's a structure here. This hole that I'm looking through right now, can you see me? Yeah, this hole that I'm looking through right now is called the obturator foramen. Through this hole come many nerves, essentially nerve structures. They're going to come from the low back up here, and they're going to branch out left and right, and they're going to come down. They're going to go through the obturator foramen and down the leg, and that's one of those nerves, the sciatic nerve. Okay, nerve structures come through that obturator foramen. There are also muscles that attach on every one of these little points. Incidentally, this hollow back here, all right, this is where your butt cheek anchors in. This is where your gluteus maximus, medius, and minimus anchor in, and then they're going to attach onto this bone, okay, which is called the greater trochanter. Anytime you see a bony prominence, like a bump on a bony structure, we call that either a tuberosity or a tubercle, and it's essentially an anchor point for various muscles, tendons, and ligaments. All right, so that's what that functions to. It's a sturdy anchor, the pull of the gluteal muscles, among others, on this greater trochanter, make it so that it's a very strong, densely bony structure that can hold on to the muscular lashings. What else we got in the hip? The most common injury that you're going to run across in the hip, particularly in older folks, all right, is a hip fracture. All right, and the hip fractures typically occur right here. All right, so again, here's the stinking femur, and here's that greater tuberosity out here, greater trochanter, rather. And I'm not going to pick up that damn phone. Here's the ball, all right, and then here's what's called the femoral neck. It's kind of obscured by this tendinous structure here, this brownish tan tendinous structure. But this is a neck. It's like a little bit of a, or imagine it as your neck, and now imagine a little bit of a fracture, a break in that neck. It's the weakest part, and especially when, shut your mouth, especially when people will have lower bone density and have problems with their balance and their strength, will issues arise, and it's never a good thing. All right, so keep that in mind when we're talking about the hip. We've got, to review, we've got the femur, we've got the femoral head, we've got the femoral neck, we've got the pubic bone, the ass bone, or the ischium, and we've got the ilium, this big blade, this big wing, inside which sits the gluteal muscles. The obturator foramen, pointing at you. And I think we've covered everything on the hip and the pelvis. Very important area. It's one of the strongest areas in the body, and all the emphasis from your butt cheek muscles and your low back muscles and your quadriceps and hamstrings, they're all coming to and attaching on your lower body at the hip or the pelvis. You understand that? Good to go. We got the hip under our belt. Signing out. Stay motivated.